So now you get a kid coming to you, and you're worried about reflux. Do you do any studies, or you just treat it empirically? What will be your approach?
Well, gastroesophageal reflux is actually a clinical diagnosis. So if it sounds like a refluxer or looks like a refluxer, the first line of approach is to try an acid blocker, which is usually...
Is there any particular one you try in a baby more than another?
Well, I usually start with the H2 blockers, either Zantac or Pepcid, and they're very safe, side effect free basically, and if the child responds positively, then you have your diagnosis.
If for some reason you knew the kid had it and wasn't improving with them, what else would you go to?
Well, after H2 blockers, the next line are the proton pump inhibitors like Prilosec, Prevacid, Nexium.
Okay, and have you ever had a kid, even with all this medicine, it didn't improve?
Yes, but then usually the issue is that there's a food intolerance, like an allergy, or you have a really severe gastric emptying problem.
Years ago, there used to be a lot of kids getting surgery for this, and today it seems very rare. Do any of these kids ever have a surgery for reflux?
Surgery is indicated if the child has severe reflux resulting in either repeated bleeding, so they're anemic, repeated vomiting, so they're failure to thrive, or such severe irritation of the esophagus that it can't be healed. That's the indication for fundoplication. And now that they can do it percutaneously, there's more interest in it again. But usually people think of it as their last line.
So sometimes it's a little bit faddish because it was in fad, it's out of fad. Are you saying it's coming back like a 70 fashion?
It's definitely a pendulum. So the more we use a procedure, the more complications we note from it. And so then I think people look for an alternative. But it's a very good procedure if you really need it.
So if you're selective, there are some kids you have no choice, but there are not as many as we used to think years ago. Is that true?
Correct. I mean, basically you have to understand why the child's GI tract isn't functioning. You can't just go do a procedure and expect that everybody's going to be all better. So, but if you know what the pathophysiology is and you work within it, the fundoplication can be